Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Hi, welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Woeller. And in this conversation, we're going to talk about some conditions, one called PANDAS, another called PANS. One of the amazing things about our body is we have an immune system which does a tremendous amount to keep us healthy, fight off infections, etc. But sometimes things go sideways, where our immune system starts to recognize different things in our body as being foreign, triggering an autoimmune disease or autoimmune condition. So rheumatoid arthritis, for example, is an autoimmune disease, and there are many others. Well, PANDAS falls into that category, and the problem is we're getting adverse immune reactions to certain structures in the brain, and that can have a devastating effect, particularly in children. Special needs kids with autism often have these, but others as well. And the problem is it can trigger a tremendous amount of behavioral issues, as well as what are called vocal tics and motor tics, different types of physical manifestations that can be incredibly devastating, not only for the child themselves, but also the family. So I am joined today by Melissa Smith, who is a certified pediatric nurse practitioner, who is a specialist in PANS and PANDAS, and she's going to walk us through this information, give us some insights into how she views it, how things are diagnosed, different types of interventions, etc. So Melissa, welcome to the program.
Thank you for having me.
So before we dive into the topic, give the audience a little bit of background of your education, your training, and how you got interested in this topic.
So I received my Bachelor's of Science in Nursing in 1999 through Michigan State, and went back and got my Pediatric Nurse Practitioner in 2014. I've done pediatrics since I got my nursing license, but I had a patient that came probably about 6 or 7 years ago, and his dad had brought him to the clinic, and he said, I just don't know what else to do with him. His behavior is so bad. We're going to put him in, we're going to commit him. We don't know what else to do. And I looked at him and I said, before you do that, let me run some tests. So I started to run some titers, and he indeed had PANDAS. So I worked with him, and basically, long story short, he didn't go into he was never committed because we helped him. And that opened my eyes to what's going on with these kids? Why are they changing so drastically in behaviors? What causes a child who is otherwise an outgoing and happy child is suddenly doesn't want to leave their room. They don't want people to touch them, right? What is that? What is causing that? And so it really got me thinking and interested in looking at from a more functional medicine versus traditional medicine view.
All right, so let's define it. Give us a definition and description of PANDAS.
So PANDAS is pediatric autoimmune neuropsychiatric disorder associated with strep, but PANS is the umbrella term, and PANS is pediatric autoimmune neuropsychiatric syndrome. And so if you look at PANDAS, it's specifically strep is the trigger. And it's interesting because I view everything now as PANS because it's never just one thing, ever. And so when you look at PANS, it's non-infectious and infectious, and these kids are inundated with things. And you kind of see it when that child changes, but it's years in the making. And so I hear it all the time, my child was normal, and then all of a sudden he changed. And I kind of view it as if these kids' buckets are filled throughout their life, and it's that last drop in that bucket, and you see him change, and it could be infection, it could be a vaccine, it could be many things. And now it's like peeling back those layers and saying, how can we help this child recover and get their life back? Because it is very, very debilitating.
So from a categorization standpoint, or the way things are being described now, is PANDAS now being sort of put in the category of PANS, like PANDAS is a sort of a subcondition or of PANS? Okay, that makes sense.
Yes.
And really that's kind of how I've always viewed it too. I mean, I've seen a lot of kids over the years with PANDAS, because you do the tests, you can see the titers that are elevated, and they've got the characteristic, time frame of how things occurred. But then there's just a lot more other kids who fit more of that PANS type of description. It's not strep per se, but it's something else or multiple things. that are going on. So what are some of the unique physical and mental emotional manifestations of these conditions?
So it's interesting. Through the years, I've seen it a lot of different presentations. So one of the hallmarks is a distinct change in their behavior. So these are kids that were outgoing. These are kids that had friends and just, were enjoying life. And then all of a sudden, some of them don't want to leave their house anymore. They don't want to leave their room. They get very violent. A lot of them have very violent outbursts to where this was not their child before, right? They have OCD, tics. They can have verbal and motor tics. Hallucinations is a big one now that I see too with these kids. And also the behavior is the biggest thing I see, but even some people, intense fears, like separation anxiety is a huge one. Intense fears, I have kids that don't want to throw up, so they'll do everything they can. This isn't like they used to be. And it gets to the point where they can't leave the house because they're so focused on these either OCD rituals that they're doing, or they just can't interact with life the same way that they used to. And so it presents a bunch of different ways, but primarily it's just very, very drastic changes in their behavior.
So would kids with typical PANDAS, let's say, will they all have some type of vocal or motor tic?
No.
Okay.
No, they won't. But it's always interesting because if you look at the different ways that they present with even difficulty focusing. So difficulty focusing in school, brain fog. There's a list. I mean, any symptom you can think of can be related to that. And again, that's why I view it as PANS, because there's so many factors, especially non-infectious factors. Infection does play a huge role, and it's because those titers, when they're high, if you do strep titers or mycoplasma titers or you do Epstein-Barr, they're high because the body's over-responding, but what they do is they cross into the brain and they act like dopamine. So they stimulate the brain. And so it's one more log on the fire, so to speak, right? So it's an added issue with what's going on, but it is multiple factors, and they don't always present with tics.
So we'll talk about strep with regards to PANDAS. What is the form of strep that is most associated with that?
Streptococcus B, I'm the one that we normally see, but it's interesting because that's the one that we test for in our titers. And again, if I see that is super elevated, I don't typically, if it's not an active infection, some kids will present and you do a throat culture and it's actively, they have strep and you treat it and you see a drastic difference in behavior. But some kids, when you catch them further along, and it doesn't give me a time frame to know when he had his last strep infection, but it tells me, if you catch them further out, it's not active anymore, but the residual is what's affecting his brain. So his brain is just inflamed, and it's a residual effect of having had an infection at some point, but no timeline, if that makes sense.
So the group A beta hemolytic strep is what's classically linked to PANDAS.
Yes.
So has it been your experience, though, that other forms of strep could maybe not necessarily trigger the initial event like the group A beta hemolytic can, but maybe exacerbate an underlying problem? Because I've seen that, but I'm just curious about what you've seen. And can you maybe expand on that a little bit?
So it's interesting too, because some of these probiotics these kids are on have strep cultures in them, and that can absolutely be a contributing factor. And so I think it's, yes, to answer your question, I have seen that too. And I think it's one more issue in that big plethora of issues that this child's dealing with. And I think the more healthy that their gut microbiome was, the more healthy that they could detox, it wouldn't be as big of a problem, but it becomes one of those opportunistic things that just takes over, and all of these things come together and form this perfect storm for this child. And so if that makes sense, yeah.
That does make sense. One of the things I've seen consistently, and it doesn't happen in everybody, but I had a number of distinct circumstances in years past with Streptococcus thermophilus, being in a probiotic. And even I've had kids start to tic after eating yogurt, for example, which has the Strep thermophilus in it. So before we move to PANS and we get sort of expand on this from an intervention standpoint and testing, et cetera, can you go through a little bit about what is actually happening in the brain, what's going on in the immune system? So we have practitioners listening, as well as parents and other people within the public. So what's happening from an immunological standpoint to create such a drastic change in behavior?
So again, I think you have to look at the whole history of the child, even from birth, right? So if it's a C-section versus a vaginal delivery, that changes that gut microbiome. And so over the years, these kids get exposed to environmental toxins, mold, candida, all of these things, and it changes their neurotransmitters. And most all of the children I see are high dopamine kids. And so they just have way too much on board. And so they're super anxious. They're super just very, very ragey. And the titers, the reason that the titers become an issue is because the immune system is overreacting when it shouldn't be. And it's just one more thing that fuels the fire for them. So in my experience, when I first started treating PANS and PANDAS, I used antibiotics, and you do see improvements in these kids, but they never stay, just because you're not getting to the heart of the problem, and you're not looking into what exactly is going on at the GI level. And once you start to help rebuild that gut microbiome, these kids do fantastic. But it's balancing neurotransmitters, and so many things get in the pathway of those neurotransmitters. Serotonin being one of them, dopamine, norepinephrine, all of those. And so it all comes together, and then these kids just get very, very different behaviors. So it's one more part of it. Even latent viruses that get reactivated, so chronic Lyme, right, Epstein-Barr, again, all play a part, but the way that I go about treating it is not to use antibiotics at that point, because again, you don't have a timeline on these infections. You don't know if it was yesterday, was it 4 months ago? You just know that the immune system is still responding in a way that I don't want it to. So it's calming down, putting out the fire, so to speak, in the brain, and then keeping that fire out. So I just look at it that this child's brain is literally on fire, and they have so much inflammation, and it's peeling back the layers and saying, okay, what is it that's actually affecting? How can I help him the most?
So it's been traditionally taught that PANDAS is an autoimmune reaction affecting the basal ganglia in the brain. And so that's where you can get, emotional instability, vocal tics, motor tics, other sort of physical movement abnormalities. So is it thought that the immune system is creating a direct inflammatory response in the basal ganglia that is altering neurotransmitters, or is there somehow some other mechanism perhaps where the antigen or the substance that's coming from these organisms is directly stimulating maybe more dopamine, or maybe it's having an effect on postsynaptic receptor activity? Do you understand the mechanisms, as far as what's happening, or?
I don't think most people understand it right now. I think they're still kind of digging into that. And, but yes, I do think that titer acts specifically to increase or act like a dopamine molecule. So that's where I see that it continues to inflame the brain. I think that when you look at, if you take apart things in the GI tract, let's say, if you look at just candida, right? Candida blocks so many different pathways, and it also blocks serotonin. So kids that typically have PANS or PANDAS tend to have lower serotonin levels. They don't sleep very well. They don't, all of those things. And again, it's looking at one factor. So that's where it becomes a little bit trickier, I think, to answer that question, because it's so many things. It's never just one thing. So while those titers, and especially strep titers, play a role, I think the body is over responding to that, and then it just triggers more inflammation in the brain. But there's other things that also add to that and cause more brain inflammation than just the titers.
So that's very interesting, because one of the things you think about dopamine, so being able to either induce more production or perhaps mimicking the effects of, and one of the things that happens with dopamine neurologically is it's a very reactive chemical. So about 90% of it is stored in these terminal vesicles within a nerve cell. And you start to get slight changes in the percentage that's in that cytosolic space. The dopamine becomes reactive. It generates reactive oxygen species. It can deplete glutathione. It can damage mitochondria. So that's really, I never thought of PANDAS and PANS in that way, as being able to actually induce perhaps just more dopamine abnormality in the biochemistry. That's really fascinating. So, and then PANS, right? So the PANS is obviously more of an umbrella term. That makes total sense to me. From a patient perspective, themselves, having a family member, a child, what should somebody consider or would raise the suspicion that perhaps their loved one is having this problem? You mentioned, you had mentioned about just sort of sudden change, and maybe you can expand on that, but I know we kind of talked about this a little bit. I'm going to let you take that. But just from a standpoint of like, what are some key characteristics that somebody said, you know what, I really need to get my child checked out for this?
So I would say go with your gut as a parent, because this is, I think, is where they get the biggest resistance in the medical field. They know something is off with their child, and typically it is pretty drastic. So, like anxiety, separation anxiety is big too. I see that a lot in kids, where it's just, I don't want to be alone. I don't want to be, things that didn't bother them before. So I always tell parents, if it is very strange, like if you look back and you say, gosh, he was never like this, and then over the past couple of weeks he's changed and gotten more drastic with anxiety or OCD, or even tics that are that the sudden onset tics, all of those things, I would say you need to dig in a little bit deeper and see what's going on. Anything out of the norm for your child, because as parents, we know our kids the best. And I always tell parents, if you think something is not right with your child, you know him, and they get dismissed by medical professionals all the time because everything is fine with their brain scan or fine with this, or their blood work looks fine, but they know something is deeper. And that's where functional medicine plays a role in digging deeper and getting to the heart of the problem.
I'm curious, in your practice, how many on average doctors have some of these parents been to before they come to you guys to get assessed?
Oh my gosh, they have been to, I want to say probably 10 or 15, including functional medicine doctors too, that they just keep getting the runaround, and neurologists, GI doctors, all these different infectious disease doctors who don't recognize it as a diagnosis.
Neurologists, I bet too.
Oh, they don't. No, they don't at all. So, and then they get to us and it's kind of like, well, we're giving them a different take on it, and it works, it helps. I mean, this is definitely the best way to treat it in my opinion, but they do get the runaround from a lot of different specialists.
So just from a PANDAS standpoint,
Yeah.
Okay?
Okay.
So basic labs, what would you typically run? You know, I always tell people, you know, PANDAS is really a clinical diagnosis. The labs help support the diagnosis. There's not a lab test necessarily. I mean, the Cunningham panel, we'll talk about that, see what your impressions are. But what do you typically look at from a PANDAS standpoint, from a lab test?
So I do titers. I do the ASO antibody, I do anti-DNase-B, strep antibodies, and I look and see what those numbers show me. Now, again, there's no timeline on that, so I can't ever look at it and say, you know, this was this many days ago or weeks ago or months ago. And interestingly, through the years, I have checked those titers to kind of see how we're getting, even when the symptoms have improved. And those titers take forever to come down. So while it's a marker and it's one more thing that I look at, those are the big things I check for strep, but I also check mycoplasma titers, which is huge. Mycoplasma also with genetic SNPs plays a huge role. And so things like Epstein-Barr being reactivated, which is one of the worst, you know, that just kind of piggybacks so many other things. And so those are the big things I check for as far as titers. Lyme is a whole different beast in and of itself, but that is something you can check Lyme titers through LabCorp. It's not really that accurate. But from a lab perspective, just for PANDAS, that would be where I would start. And then there's other testing I would do.
So the Cunningham panel, is that something that you do, not do, or?
I've done it before. I feel like the information that's given there, to me, it's a very expensive test. It basically just tells me what I already know about them, which is mostly that they're high dopamine. And so while it's helpful, I think there's better tests that help me more specifically start a plan of care with kids. And that's what I think is important for parents, because sometimes I think they get test burnout. You know what I mean? You go to different doctors and they'll give you 5 different tests to do. And while that's great, you can have analysis paralysis where it's too much information, right? And what am I going to do with all of that? So I direct to tests that I know, and tests that I know will show me what I need to start a plan of care. The Cunningham panel is one more piece of information, but I wouldn't start there, no.
So let's talk about some of those other tests, because this is going to cross over into PANS now. So
yes, okay.
What are some other things that you expand upon, or some other functional medicine, integrative medicine tests that you tend to run?
So I always start with the OAT test, the organic OAT test, because that test shows me underlying colonization in the GI tract. It shows me neurotransmitter markers. It shows me vitamin levels, antioxidants, things that I need to know how the body is processing. And it gives you a bigger picture of how they're presenting. So for example, if they have overgrowth of candida or clostridium, they can absolutely have higher dopamine. And a lot of kids that have autism have those. Most all kids that have autism have high candida levels. And so those are where I typically start with that. The other test, two other tests. The methylation panel is huge. I like genetic SNPs and looking into that, MTHFR, but not only MTHFR, because most people know what that is, but it's the whole cycle. And so you have to look at the whole, like how all of the SNPs kind of interplay to help support methylation, because if methylation is not being supported, it obviously the body is in dysfunction. It's not going to be able to detox the way it should. And then food allergies and food sensitivities are very big too, because the more unhealthy that your GI tract is, the more inflammatory it becomes. And so I'm much more sensitive to foods. And I hear all the time, he constantly complains his stomach hurts, right? So these are things that I check, and you'll find sensitivities are going to be through the roof, but you help to explain to parents that's another inflammatory thing that they should consider taking out of their child's diet while we're working on everything else. So that's where I start. And then from that, I get a ton of information. It's with PANS, it gets a little overwhelming because it can be infections, it can be parasites, it can be heavy metals, it can be Lyme. And some practitioners will go for one thing, and I've seen it. They'll focus on, let's say, chronic Lyme. And so they'll use antibiotics to treat chronic Lyme, which I don't agree with, because again, you're decimating a GI tract, right? So now I'm causing more probably Clostridium infections, probably Candida, and I'm not addressing the problem. So and the body is amazing, and it will do what it needs to do when it's given the right circumstances to do it. So I look at it as kind of the body is so overwhelmed. So things that normally wouldn't be a problem become a problem, because the question becomes, for example, mold. Why are there 5 people in a house with mold and 2 are not doing well and 3 are doing fine? And it's opportunity. It's just too many things. And the body puts out the big fires when it can, but it can't do it all at one time. So I always start with the foundation of the house, so to speak, the gut, right? That's always where I start, and then let the body detox and get rid of things as we help support it.
I love that. I mean, we're going to talk more about that. I got a couple questions though. One, are there certain genetic SNPs variants that you tend to see pretty consistently in these kids?
Absolutely. So definitely MTHFR. Also ACAT, which is very interesting. ACAT's a new one that I'm learning about, but that one specifically because it has to deal with cholesterol. So people that have mycoplasma flourishes in cholesterol, and these people tend to have an imbalance in cholesterol. So that one I've been seeing more and more with children as well. COMT is a big one, because obviously that one is, I always think of it as like that exit door. And so if it's locked, so to speak, these kids retain more things I don't necessarily want them to retain. So more neurotransmitters, more things. So I always tell people it's important to know what's going on under someone's hood before you start giving them stuff, because if I were to give that child who, let's say, is homozygous for COMT, a methylated vitamin, I would make him feel very, very bad, because I'm not supporting the whole cycle. So while you can't support every SNP, those are the ones that I focus on. MTR and MTRR is also important because lithium plays a role there. So there's certain ones that, yes, absolutely do focus on. And the one that specifically they're tying a little bit more to PANS is ACAT.
ACAT, that's interesting. One of the interesting things about COMP, which is the catecholamine-O-methyltransferase, and it makes sense in how you described dopamine, right? So we need to be able to get rid of these neurotransmitters. We need some, but we don't want them hanging around forever. And so if we're not metabolizing out those neurotransmitters, they're just hanging around causing stimulation, which then brings me to the gut. And we talk a lot about the gut, of course, Candida, other fungus, mold exposure, Clostridium. And we know that certain Clostridium bacteria, even Clostridium difficile, can produce different organic acid compounds that can inhibit dopamine metabolism. So you stated up front that pretty much all of the kids, or most, I would assume, they tend to already have or being driven in the level of elevated dopamine. Is that true? So they're sort of leaning in that direction kind of already.
Absolutely.
And we can see where the Clostridium problems could be problematic, because that's one of the reasons you do the organic acid test, to look for those compounds like 4-cresol or HPA, because it inhibits that dopamine beta hydroxylase, converting dopamine to norepinephrine. And that makes perfect sense now too, is that if that system is being inhibited because of a pathogen, now that pushes that child even closer to that we'll call it a dopamine threshold. Maybe that's not the correct way of describing it. Would you say that that scenario increases the risk for PANS, PANDAS?
Yes, absolutely.
Okay.
And one of the things that I see a lot, and it's almost as if you can, a way to prove that it is the diagnosis. I have a lot of kids that come in with ADHD diagnosis, and they'll be on stimulants, and they are horrible on the stimulants, raging, not like themselves. And that's again because I took a child who was either low to normal dopamine and now pushed him and raised his dopamine super high. And so now we're just not in a great place at all. And so when I see that come in, I always think that's not the right diagnosis, because you can have also difficulty focusing on either ends of that dopamine curve, so to speak, too high or too low. And so I think when you look at these kids, yes, it pushes them way high. And it's just one more. That's a big reason why kids don't want to leave the house, because it again stimulates dopamine in their brain, and the body's trying to shut it down, because any stimulation that it gets, it's going to raise dopamine. And so it's interesting when you look at it, you're like, well, that makes total sense why they're acting the way they're acting, because of what is going on, physiologically, things like that in the body.
So when you think about the gut, because you also mentioned that you look at the gut, and so the thing that came to my mind is that things that drive gut imbalances, so whether that is an overgrowth of candida or some other pathogenic organism, or chemicals we're exposed to that create microbiome diversity issues. If we start developing a leaky gut, right, well, the architecture of the tight junctions that keep those epithelial cells together is very similar to the architecture of the blood-brain barrier. And so we can start to get a leaky gut and a leaky blood-brain barrier, and then sitting right in there, obviously, is the brain and nervous system. And the way you describe PANDAS and PANS too, we probably should just throw it all in the bucket of PANS. I totally agree with that. Is the brain on fire? And we know that in autism and many other conditions, the brain can be on fire in multiple areas. What's been looked at with regards to PANS is really heavily weighted towards the basal ganglia. But I'm curious, in your understanding of this condition, are there other areas of the brain that also get lit up from an inflammatory standpoint that could compromise other aspects of function? So for example, the temporal lobes, or with regards to auditory processing, the cerebellum, it's not just the basal ganglia. It's going to be more systemic than that. Is that correct?
Yes, and even some of these kids will have regression in handwriting. That's a big thing I see. So they were, let's say, fifth graders, now they're writing as a second grader. So you'll see declines and things like that. They're very, very sensitive to noise, to touch, to like this hypersensitivity, right? All of the things that is. So I think pretty much it's fair to say any part of the brain could be actually affected, and you see different ways that they present. But the big one too is a decline in, they don't do well in school anymore. They can't sit and comprehend. They can't write like they used to, and you actually see it. And then as they get better, they regain that. So I think it's fair to say any part of the brain can be affected by it, for sure.
What are some foods that you generally tend to also see exacerbate problems in PANS, PANDAS?
So for sure, dairy. Dairy and gluten. Gluten is one of those things I used to think was more important than dairy, but I'm kind of doing the flip now. Dairy is, it's so inflammatory. And so kids that have a lot of ear infections as kids, typically dairy is a driver, right? So there's a lot of, it just continues to promote so much gut inflammation. So I tell parents, because it is hard, especially if I have a teenager coming in, to say, hey, totally redo your diet and just take out all dairy and gluten, because our food and food that teenagers eat is primarily those things I don't want them to eat. So I always say, try your best, at least 80-20, right? Take out those foods as much as you can to help decrease the inflammation, because it's, again, one more factor that's going to promote that leaky gut and, like you said, leaky brain. So they're connected 100%. And so I tell parents, do the best you can to start. Now, some parents will take it all out of their diet, and food dyes as well, makes a huge difference. But I think our food is just it's just not good. And I think these kids are just dealing with that and the toxins in our foods. So I would say gluten and dairy are my big ones, but then based on their food sensitivity panel and food allergy panel, we'll also add foods if it comes up that way, the big ones, the big triggers.
Yeah, and those are big triggers that I've seen, just even with the special needs autistic kids, who have PANDAS, or sometimes, not always, but most do, to some level, because I look at this sort of as a spectrum now.
Yep.
And that's what makes it challenging. That makes it challenging, particularly from a conventional medical standpoint, because in that world, it's either black or white, usually, not in all things. But I think the key point in what you're getting at is we try to do things that turn down inflammation, turn down the volume as much as possible. And yes, the initiating event occurs in the brain or appears to occur in the brain, multiple areas, because you get these quick dramatic changes. But from a fundamental functional integrative medicine, I look at it really think about it from a naturopathic medical standpoint, because these are the practitioners that really have been talking about this kind of stuff for decades. It begins in the gut. So Candida. So I want to see if we can, I know it's difficult. I might push you a little bit on this, okay? But try to ranking things of what you have seen in your practice that, I get it, group A, beta hemolytic strep, PANDAS, yes. PANS is a little bit more varied. But when you sort of think back in all of your clinical experience, are there certain entities that tend to be more of a driver of problems? And I'll give you an example. One of the things that I've seen in clinical practice is those individuals who tend to have a lot of chemical sensitivity to environmental chemicals, perfumes, deodorants, etc., who have a lot of histamine-related problems, MCAS, whatever, often, not always, but most of the time have had some type of mold exposure. And I don't want to make it sound like mold is the only thing, right? But it's whatever is going on with mold and the biological entity that it is, it just seems to really aggravate the immune system. So if we were to think of mold, Clostridium, Candida, food, maybe some other things out there, what have you seen in your clinical practice that really seems to be an aggravator in PANS PANDAS?
So it's interesting you bring up mold. Fungal overgrowth in the GI tract, be it Candida, be it mold, is a huge player in this because, again, it disrupts things. So I have a lot of my PANS kids that do have MCAS. They have big histamine imbalances. And again, it's driven by, when you look at Candida, any fungal overgrowth, it actually blocks that whole histamine pathway. So kids tend to be higher histamine. So most of these kids have allergies. Most of these kids they have just very allergic in nature. But if you look at when you ask what's the trigger, there's so many of them. And that's why I always start, there's an order in which I do things, and it's always to start with the gut, clear colonization, work on Clostridium, and then work your way out. Because if you take something like, let's say, parasites, which people do all the time, and they'll try to detox parasites, if your foundation isn't strong and you start there, right, and you have a leaky gut and your drainage pathways aren't open, then what happens is you feel horrible, right? And you're doing it, it's not the order that I want to do things in. So, and when you start with the GI tract and you get that super strong, everything else the body tends to do on its own, so it will get rid of things. So I think that's where PANS is very overwhelming to people, because it could be so many things. You're like, well, where do I even start? It could be infections, it could be mold. But mold is one of the things I always ask about in the first visit. Do you have any exposure? And most people don't know, but you get their O test back and they do, and there's just different treatments for those. But that's where I start. Those are big drivers of, like you said, MCAS. That's a huge driver of that. And I see that in a lot of my PANS kids.
One of the things to keep in mind too about Candida is it's a major driver of leaky gut, because the invasive forms, it causes mucosal reactivity in the gut, it drives its hypha structure either through a cell or through that tight junction. So it could be a major contributing factor, if not causative factor in some cases, to leaky gut. Let's talk about the duration of problems with these conditions. Months, years, what is a typical thing you're seeing in how some of these individuals, particularly the kids, are struggling with?
So before, when I started treating it and was only pretty much using antibiotics and anti-inflammatories, they would always relapse. It would be if they got sick, and it could be anything they got sick with, not necessarily strep or mycoplasma. But when I started a different approach, I took the approach of let's work on the foundation, let's get this super strong. within months, you can see small changes. And I always tell parents it's a marathon, not a sprint, right? They didn't get this way overnight. So I can't give them something to automatically make them better tomorrow. But little things, like, for example, I had a little girl who it took her about 2 hours every morning to get dressed because she couldn't do the textures. And she would rarely leave the house. It was just this big, it just got worse and worse. And within the first 3 months or so, she had gone to her first daddy-daughter dance, and she was able to do more things socially. So it's little changes along the way but you can see them pretty quickly. But I think the important part of that is I'm not just putting a Band-Aid on the problem with an antibiotic, I'm treating the actual source. And I always tell parents that's what's going to give them long-term health is by getting them to be in a much healthier state, just by treating their gut and giving them a strong base.
Let's talk about some of the interventions that you've had success with and where you go with that.
So after I do all the testing, I identify whatever I can colonization-wise, and we start there typically. So we'll start with some detox. I support methylation. So we look at the methylation people that have, for example, homozygous MTHFR C677T is worse. So we look at the different ones and we say, okay, how can I help support you detox? A big problem with the kids I see too is constipation, huge problem. And I always tell parents it's another drainage pathway. So if I can't get them to move their stool, then it doesn't matter what I give them, they're not going to absorb it. So we work on and it's pretty much every child that presents that way. And again, I think it's a food issue. It's a food issue, it's a leaky gut issue, it's an inflammatory issue. So by slowly, and then supporting with other supplements. So things like, NAC to increase glutathione, the things that whatever the OAT test also shows me that the body's needing to balance that. And then LDN is another big medicine that I use. I love low-dose naltrexone. It's a fantastic anti-inflammatory. It acts directly in the brain on those glial cells to calm that neuroinflammation. So some people will use steroids as an anti-inflammatory, but steroids, if you have underlying Lyme, that is not a good choice to do. And steroids, I don't want them on it for a long time anyway. So LDN has been fantastic to help these kids. And LDN, interestingly enough, will stop tics within a day or two. I mean, it is a fantastic anti-inflammatory. So that's my big thing that I usually reach for as far, because you want to put the fire out, but you want to keep the fire out is the way I look at it. So you want to keep that inflammation down.
Do you tend with the low-dose naltrexone to use the capsules or cream, transdermal?
Capsules or liquid.
Liquid, okay. Yeah, I've had a lot of experience with LDN in various conditions, most of them autoimmune based, and it can be extremely powerful. Let's talk about antibiotics, because that's often a go-to from a conventional standpoint. You and I know, working in this field, that sometimes antibiotics, just like an antifungal prescription medication, may be needed or necessary in certain circumstances. It doesn't sound like that's a main go-to for you, although perhaps in the past it was, as you were just getting going. So let's talk about just some antibiotic interventions as a potential option. Of course, we want everybody out there to be working with a health practitioner who is skilled and knowledgeable in these areas. They're not doing these things on their own per se. But what's your take on antibiotics for this?
So I will, if their titers come back very high, let's say they have super high strep titers, and they're in a place where their mental health is at such a place that they can't function, I'll try a round of amoxicillin. I typically do 2 weeks, a little bit longer, and then see how they respond. Some kids respond great to that. If their mycoplasma titers are high, I'll start with azithromycin. I'll typically do that for a little bit longer. And then if they flare along the way, which these kids do sometimes, I will go back to using antibiotics for a brief time. So if they're exposed to, let's say, anything and they get sick, kids will flare in much the same way that they did the first time, even if it isn't a strep infection or a mycoplasma infection, but they do respond to antibiotics. The other place I would use them is for Clostridium infections. A lot of these kids are so angry, and that's the biggest thing I hear parents say, like, he's hitting his brother, he's violent, and not like this child was ever before. And so Clostridium is a huge driver of that. So I will use things like usually vancomycin is what I would use, and pulsing that, right? Because you don't want to just do a 10-day course. And that will also bring down a lot of that rage, because again, that whole DBH enzyme we're talking about, that it blocks that breakdown. And so it's helping these kids to kind of calm down a little bit more, because the raging is a big thing that I see. But that's primarily where I use antibiotics. Some practitioners will use them for months and years on end. And I just, the long-term effect of that, in my opinion, does not, it's not worth it. in my opinion. I think you have to work on the gut. I think you use them as you need them for sure, because they are necessary, but they're not a long-term. You can't keep someone on antibiotics for life, if that makes sense. I mean, you know that, but they do. They keep them on for a long time. Yeah.
Makes perfect sense. And I would absolutely agree. You're using these things as targeted therapy for a brief period of time to get through a crisis. You know, I've talked about this in some of the teachings I do for Clostridium problems, particularly things we see off the oat, particularly for things that are occurring with, let's say, some of the autistic kids. You have to base your treatment recommendations on the severity, the clinical circumstances of each case. And so ideally, we try to deal with these things as naturally as possible, but you and I know that sometimes we need some things to just get us through. And I'm assuming that's going to be the same thing for even prescription antifungals, right? We try to do things as naturally as possible, but sometimes for a short period of time, they can be extremely useful. Which brings me to some of the psychiatric medications, particularly SSRIs. And that's a whole other topic, could be controversial, of course, but what is your take on that in crisis situations where things are just really out of control? Useful, not useful? What's your thoughts?
So I definitely think it can be useful, and I have used it in cases where these kids just cannot function with everyday life. Now, I say that if you look at the oat test, quinolinic acid is a big byproduct that I think you have to be careful of in that pathway, because if I give them more available to use the wrong way, they're going to be in a worse place. But overall, I do use SSRIs if they cannot function, and just for a short period of time as I'm working on the gut. So I always tell parents, it is a process to rebuild that gut. It's going to take a while. So let's use this for now. And as he feels better and feels healthier and starts to see differences, we'll get him off of the SSRI. So again, kind of like antibiotics, they're useful when they need to be. I don't do antipsychotics. I don't do anything like that. If I do reach for something, it'll be an SSRI, but only for short periods.
Would you view steroids kind of in the same light? You know, yes. Short burst for a short period of time to just get things under control, but obviously not long-term as a cure-all.
Yes. And interestingly, steroids, you got to be careful with that. A lot of my ragey kids do not do good on steroids. And that's why I like LDN, because I feel like LDN does the inflammation part it needed to, but it doesn't cause the side effects that steroids can cause, because a lot of times these kids will get just so much worse with steroids. And you can use them, but longer than 5 days and take a break. And so LDN is very safe to use long-term, and it's very effective.
So intravenous immunoglobulin therapy is out there. We also have plasmapheresis. Any experience with those?
Absolutely. So I had a couple cases, very extreme cases, where I did use IVIG. I think it's a good complement to treatment. I've never seen a child go and be completely cured after an IVIG infusion, and there are risks with that IVIG infusion that I have seen. So I pick and choose that very carefully. I have used it in the past. I have had good results with it, but it's definitely not for every child. It's more of you got to look at the whole picture before you reach for IVIG. What
are some things you need to be careful with from a supplementation standpoint? There's a number of different products that people will reach for, but any things that you think about sort of come to the forefront of be very cautious with these, or consider these to be used in only certain circumstances?
So it's interesting. I had someone reach out to me about the NEM-check protocol, which is used a lot in PANS, which basically assumes everyone has SIBO and treats it that way. And it's interesting because I sat down with her and I said, not everybody does. And so if you approach it that way, without knowing any kind of information, then you're not going to see the results that you can. So I say that because supplementation based on someone's oat test, supplementation based on someone's methylation panel is super important. CBS affects glutathione. So people that have a CBS SNP should not do glutathione, and we give IV glutathione all the time. So I think you just got to be cautious, because people can feel very bad before you make them feel better if you don't reach for the right thing. So that's why I like to do testing before I even recommend the supplements. Supplements are expensive. They're not a one-size-fits-all. So it's based on what the body tells me it needs.
And I would 100% agree with that, particularly, we've talked about this before in some of the organic acid test trainings. One of the reasons you always want to do that test is to look for Clostridium. Because if you just start randomly taking certain amino acids, L-tyrosine, phenylalanine, for example, certain herbs boost L-dopa, you're going to drive that dopamine more. And that's just going to turn up that volume even that much more. I'm curious about nutritional lithium. Have you had some positive experience with that in this particular condition?
Yes, especially if they have SNPs and MTR and MTR. I use it a lot there. Because lithium acts to move vitamin B12, it's super, and it can lower dopamine levels. And that's why I find it interesting pharmaceutically, they use that for schizophrenics and things like that, because that is a high dopamine state. And so I do see a lot of good results with lithium. And if it's based on their methylation panel, I will use lithium orotate, and it does actually make a huge difference. I do use that.
So hippocampal problems. Do you know of the hippocampus getting hit in PANS, PANDAS, to a significant degree? I mean, is memory problems something long-term that these people are at risk for?
I don't think long-term. I've never really seen long-term issues result from that. I think in the moment, but then as you work to get their health back, they don't typically have these periods where they don't remember, periods like that. I think it's reversible for sure. I just think it gets worse untreated in the moment, if that makes sense. Not really long-term that I've seen.
What about adults? I mean, I know you're a pediatric nurse practitioner, but is this something that, obviously it wouldn't be called PANS because it's not pediatric, but still the mechanisms could be the same? For adults, for example, that may be experiencing problems and say, hey, wait a minute, I might be, experiencing these same types of things. Is this something that you've seen, or maybe you have colleagues you work with who work with adults where this is happening?
Absolutely. And I think the difference between adults and kids is that as adults, we're able to kind of control things a little bit better, if that makes sense. So I might not feel good, but I'm not going to socially act like a 3-year-old toddler would. I'm going to be able to kind of keep it together as much as I can. But yes, and I think the more toxic our environment becomes, the more toxins we put in our bodies, it's going to continue to present the same way. So absolutely, mold is a big thing, candida, all of these things we're talking about that further make it very similar. I just think adults they can rein it in more than kids. I think kids they just can't manage their emotions as well. So yes, I think it's very problematic even in older people as well.
Are there certain types of vaccinations that you've seen trigger this condition?
So it's interesting. One of the things that they do to prove that someone needs IVIG is they check pneumococcal titers, and then they give that child a Prevnar dose. And I have seen kids get so worse from just that, like ticks worse and things like that. So I think any vaccine has the potential because, and I always tell parents, if they're not detoxing properly and I give them toxins in their body, they can't clear it. So it sits in cells and it becomes an issue. And it's one more, again, log on the fire for them. So it's not the only thing. So if I'm doing any kind of treatment with parents, I say, if you want to vaccinate, that's fine, but let's take a pause because I really need to work on this. I need to get his brain much calmer. I need to get his gut good. And then we'll talk about when we're in a much better state to tolerate vaccines, we can go from there. Not one particular vaccine, but definitely it's like the last straw for a lot of kids.
Yeah, it's another potential trigger of immune reactivity and inflammation in an already vulnerable brain that's already inflamed and aggravated. So just as you mentioned, one more log on the fire. Do you have an interesting case that comes to mind that maybe sort of profiles this and wraps this all together?
Sure. So I had a 5-year-old come to my clinic, met him the first time. Now he was developing normally. He was speaking, he was doing all of those things. And he had a slight, really marked regression in his development. And he started to hallucinate. He started to see things and talk to things that weren't there. He would not sit and talk to his mom anymore. He wouldn't carry on a conversation. It was very difficult. It was almost as autism. He was not autistic. And so when he met with me, he was walking around the room, just kind of hallucinating, carrying conversations. So we did a lot of the testing that I told you about, and he definitely had PANS, went ahead and started treating. And within 3 months, that child came back and he had a conversation with me. He wasn't hallucinating anymore. And I think that the point of that case especially is that mental health people, I think, misdiagnose these kids. And if as a 5-year-old would have been misdiagnosed with schizophrenia, right, which is a high dopamine kid. So I think helping families and not putting them on all of these different kind of meds, listening to what these parents are saying, digging deeper into their overall health and helping these kids, because I think they are in a disadvantage with our environment. I think that from the get-go. And interestingly, one final thought is that I see a lot of babies now that are being born with tongue and lip tie and umbilical hernia, and that is all methylation, and it's not normal. And I always tell parents, I think it's really funny because I've been doing PEDS for 24 years, and I have never seen every single child walk in that door with a tongue and lip tie. And so it makes people should start to question and say, what is it? And so I always tell parents when I see that, be careful with vaccines, be careful with things, because I know from the get-go this child can't detox. So I think it's going to become more and more. I think you're going to see this more and more in the future, unfortunately, with PANS. And it's just it's multifaceted.
Wow, that I didn't know. That is concerning. You know, one thing you mentioned about MTRR, right? The methionine synthase enzyme. As you're describing this, one of the things that I've seen in the past, well, still do, but in the past, a lot of times with regards to the autistic kids, is within the methylation cycle, it's known that that particular enzyme is highly vulnerable to inflammation, oxidative stress, and certain chemical compounds. So ethanol, acetaldehyde, pesticides, for example, inflammation, oxidative stress, and that's that enzyme important that connects the folate methylation cycle to convert homocysteine to methionine. And a lot of times in my early years when I was practicing working with methylation supplementation, is I would do methylation support, methyl B12 in some of these kids and not get the clinical response that you would expect. And it wasn't until you actually brought gut pathogens down, particularly Candida, that things start to awaken and open up. And there's so much to that enzyme, because you mentioned certainly within the methylation cycle. And I think that's another discussion we could have just on the whole aspect of methylation chemistry, testing, analyzing it, supporting it. So that's a really fascinating. So you mentioned that that scenario is a methylation problem, correct?
Yes. But I will say too, most of my children are what I call methyl sensitive. So it's interesting because I would start kids off on big methylated vitamins and they would get so much worse. And again, most of the children that come to me, I do a separate non-methylated B complex with methylation drops, because if you do too much too quickly, they don't do very well. And I think I don't want to say it's every child, but I just have learned to use that protocol more, because their gut is in that place where they can't handle they overmethylate very easily. And overmethylation is how you see you see high dopamine, right? You just see kids that are like very anxious, very over exactly how they're presenting. So I think, yeah, again, it's looking at every case, but methylation is really one of those things that has to be looked at per case. And I just tend to err kind of low and slow. And I tell parents, just because I think that's how the best way to approach it for these kids.
Well, I think your approach is very good, because the reality is, as parents, yourself as a practitioner, you're walking a tightrope, right? Between doing too much and creating issues one way and not doing enough where things are not really improving. And it's obviously complex. It's not just a brain problem. It's not just here, throw an antibiotic or an antifungal or even a antimicrobial botanical. It is a systemic problem that has to be treated comprehensively. And that's exactly what you're doing. It's amazing.
Thank you.
So any final thoughts? Any final thoughts for practitioners out there who are listening, parents themselves who are listening, points of emphasis? Yeah, what kind of recommendations do you have?
So I just always want parents to listen to their gut. And if they feel like something isn't right with their child, to know that there is help out there and people that do understand what they're going through. And it is a real condition. I think parents get dismissed a lot with that, and they get very disheartened with it because they see their child changing. And I'm a mom, I have 2 children. And so as a mother, if someone dismissed me when I know something's wrong, it would just break my heart, because you see your child slipping away. And so that there is absolutely help out there, and that just kind of go with your gut if you need those resources. And just keeping in mind that PANS is very, very multifaceted. I think that's the bigger thing. I think with this, and I know with this condition, parents want one thing to be the contributing issue, and it just never is. And so I think they go after one particular thing, be it chronic Lyme or parasites or whatever, toxins, but it's never just one thing. So I think if they get that diagnosis, be patient. It does take a while. It is reversible, but it's not reversible overnight, and it's never just one thing.
Great advice. Where can people find you? Give us some resources.
My clinic is New View Integrative Pediatrics, and you can find me online. And I do autoimmune stuff, Lyme, and everything we're talking about, PANS, PANDAS, ADHD, anxiety. And yeah, that would be a fantastic thing. If you have any questions, you can contact me that way, and I'm happy to do even a phone consultation and see if I'm a good fit.
Great. Melissa, keep up the great work, and thanks so much for joining me today.
Thank you so much.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Woeller. For more information about this podcast, go to functionalmedicinedoctalk.com.